causes high PSA and how to lower it naturally? Let's talk about it. As a hormone specialist, I've been following middle-aged men with creeping PSAs for years. Prostate-specific antigen, or PSA, is a measurement of protein produced by the prostate. PSA elevates as the prostate enlarges, either from inflammation, infection, cancer, or testosterone deficiency. All aging men have lower levels of testosterone than they did as youth, and their prostates enlarge to suck up more testosterone to convert it into the active form, dihydrotestosterone. If your PSA is elevated, then you must also have your percent-free PSA measured. Men with 15 to 25% of their PSA free or unbound are considered within normal limits. Over 25% free PSA usually indicates an enlarged prostate. Less than 15% free PSA is suspicious for dysplasia and early cancer. Less than 7% is highly suspicious of cancer. Your percent free PSA should be checked before any invasive testing. Many men undergo unnecessary biopsies based on a test that was never meant to be used as a screening test. If you're going to have your PSA levels measured, then be sure and ejaculate within a week of the test, but no sooner than 3 days for the most accurate result. And never have a PSA test within 48 hours after having a digital rectal exam. Touching the prostate will raise circulating PSA levels. For marginally elevated PSA levels 4 to 10 with low percentage free PSA, I do recommend a prostate ultrasound, not a biopsy yet. Prostate MRIs are much more accurate in determining the need for biopsy as well as exactly where to obtain tissue samples if a biopsy is indicated. So if your PSA is elevated, breathe. Then do some investigation as to the cause. Do you have a strong family history of prostate cancer? If so, then follow your PSA, and if rapid elevation, seek specialist care for further investigation, like an ultrasound and possible biopsy. Do you have symptoms of testosterone deficiency like low libido, erectile dysfunction, insomnia, night sweats, anxiety, depression, poor muscle tone, low energy, brain fog? If so, then get tested by a hormone specialist. Are you experiencing signs of an enlarged prostate? You have frequent urination, nocturia, meaning you're getting up at night to urinate, difficulty voiding or emptying your bladder, a weak urinary stream, rectal pain or heaviness following ejaculation? If so, then you may need a urine analysis, then a digital rectal exam followed by a post-exam urine analysis. The 2 urine tests are compared to differentiate between bladder and prostate infections. I have used testosterone replacement therapy in my male patients with subsequent lowering of their PSA levels. I've had excellent results with Genesis Gold in harmonizing male hormone levels for those who do not wish to use testosterone replacement therapy. And for those who do, Genesis Gold really helps them metabolize their hormones safely and helps decrease the risk of using too much, so we can lower their dose because less is more. Now, the herbs saw palmetto, pygeum, and pumpkin seed oil, as well as beta-sterol, can also help to decrease prostate inflammation and lower PSA. If you have any questions regarding your PSA, why don't you join us in our Hormone Support Group, where I address your questions live. You can access the free group by signing up for our Hormone Reboot Training. I'll see you in the next video.